and welcome to Dialogue. I'm Hu Naijun. In a press briefing Thursday, Chinese health officials responded to serious questions about the country's medical supplies, COVID death rates, and the new measures announced this week on the country's policy shift, which includes lifting nearly all travel restrictions starting early January. So what is the latest on the spread of the Omicron variant in China? Is the country prepared to safeguard people against future infection waves, especially vulnerable groups such as the elderly? And is this the beginning of a gradual return to normalcy after 3 years of zero COVID policy? To discuss these issues and more, I'm joined today by Einar Tangen, independent current affairs commentator, Dr. Alice Tan, internist at MizMedi Women's Hospital, and Hu Naijun, associate professor at the School of Public Policy and Management at the University of Chinese Academy of Sciences. Let's start with our reporter, Chen Ziyuan, on the latest developments of the recent outbreak in China.
China has considered potential risks from its latest pandemic policies and travel resumption across borders. A press conference held by the State Council responded to recent debates over the new policies and reporting of the death rate from COVID. Experts defended the policies as timely.
We think the adjustment is appropriate and is scientific. It complies with the law and it meets the current needs of prevention and control.
Without mass testing, some have wondered whether China's outbreak has reached its peak with people staying home from work and the upcoming holidays. An expert at China CDC says the virus is spreading quickly.
The COVID-19 is transmitting at a high level in China. The provinces and cities are entering different phases at different times. It won't be happening at once and stop immediately. Some develop faster, some come slower.
In response to doubt over transparency of data, a National Health Commission official explains how China is reporting the death rate.
If the patient is tested positive, the person is died of respiratory failure. That will count towards a death under COVID-19. If the patient has COVID infection, the person has fundamental diseases, then not under COVID.
Excess mortality over normal mortality levels is also another way to understand the real death rate linked to COVID. Wu says a team of experts is working to get the latest data.
China's CDC has a team on it. In 2020, this team analyzed the excess mortality of that time and published it. They are also working on the current number. That data will be released later on.
The new policy is a major shift of the country's focus from prevention of infection to prevention of severe symptoms.
It's an infectious diseases mentioned by laws. Government, entities, and individuals still have to follow China's law on prevention and treatment of infectious diseases. The policies are different in terms of quarantine, tracking transmission, reporting information, and zoning policy.
Officials have recognized the structural shortage in production of medicine, but the overall supply is catching up. The National Health Commission says China is trying to build and utilize a three-tier medical network from community to top-tier hospitals, allowing its citizens to get help within their community and leaving the medical resources to those really in need. Chen Ziyuan, CGTN, Beijing.
Well, Anna and Naijun, since both of you are based in Beijing, I have this question for you. One question a bit controversial has been the opening up of the society. Some in the West have criticized the operation, saying China is not properly prepared for the sudden change of the policy. So, Anna, I will start with you. What do you make of this criticism?
Well, it sounds a little bit hypocritical. All we have to do is go back to November 28th, 29th. There was a series of press announcements also by the government, the State Department, declaring that China, was, denying human rights and being coercive and ruining the world economy because it wasn't opening up immediately. And then you go to today, and all of a sudden China is wrong because it's opened up. So at this juncture, it's clear for countries, especially the United States, there's no course of action that China can take that isn't going to be wrong.
Naijun, just as Anna pointed out, previously the criticism is like, oh, China is isolating itself from the rest of the world. And now when China opened again, it's criticized for opening up too quickly. What do you make of that?
Well, I think from the preparations point of view, I think China is more prepared than any other country in the world to open up our border. As we all know that during the last 3 years, we have made a dynamic zero policy. We have protected our people very well. And we also have vaccinated nearly 90% of our total population. And from the medicines and the other treasure or treatments point of view, we have also, in my opinion, good capacity building. We have good production capacity. So I don't think we are not prepared. In my opinion, I think we are well prepared for all the things that will happen after the opening up.
We'll come back a little bit to that point later. But Alice, another controversial issue seems to be about the death rates or the number of the deaths here in China. But the question is like, is there a universal or common understanding or common definition of death with COVID or death by COVID? There must be certain criteria, but what about the criteria?
Right. Well, according to the WHO, if a person has died and the probable cause of death is clinically compatible with COVID-19, and there is no other probable alternative reason for why this person has died, and the person tests positive for COVID-19, or it's probably likely that the person has COVID-19, then we would classify that death as death due to COVID-19. Of course, there is a little bit of a gray, I think, area, and also because COVID has so many different manifestations, it affects the blood vessels pretty much in every organ system of the body, and it can increase your chances of having many other life-threatening illnesses, not just pneumonia. And so it is difficult to assess. But as was mentioned earlier in the broadcast, later on when the statistics come out in terms of excess mortality, I think then that will give a more accurate picture in terms of the true impact of the pandemic and COVID on excess deaths in China.
Okay, so is that a common practice for different governments probably that will introduce or they follow different criteria?
Well, at this point, because testing is so prevalent, and for any patient who's admitted to a hospital, it's very common standard practice to test for COVID. And so it becomes easier to diagnose a patient who's coming into the hospital. It becomes a little bit less clear if there's a death that occurs outside of the hospital. But countries around the world, they commonly do take note of in terms of death statistics month by month. And so there's a record in terms of expected mortality for a certain month. And usually it's the last 3 years data, and you can get that data from before the pandemic. And so if you compare month on month, what's going on in terms of the mortality statistics, that will give you a very clear idea of what's going on due to COVID.
We are soon to have the exact number, according to Wu Zunyu from the Chinese CDC. Naijun, in general, can we say the infection rate is more than we expected? It is also true, with the case of the death rates.
Well, I think from the infection rate, after several cities' rounds of infection wave, such as Beijing, such as Zhengzhou, such as Chongqing and Guangzhou, I think we had a very relatively exact data of infection rate. We have estimated that the infection rate may be a little higher if we lifted all the original policies of prevention and control. And right now, just as some experts have estimated, for example, Professor Zeng Guang just has mentioned that Beijing's infection rate may be around 70 to 80%. What he had said is that a little higher than we had expected. I think this is due to the season that we lifted all the policies because we are in the winter time and in the time when there is no COVID, people usually intend to be more infected by other kind of flu or virus, or people intended to be more easily to get a fever or get a cold. So I think we can't neglect the season's reason of this opening up.
Mm-hmm. Well, Anna, there's been a shortage, in particular at the beginning, the shortage of medical supplies, medicine supplies in particular, as the Omicron variant rushed through the population, for example, in Beijing. But overall supplies are catching up. If you have 70% of infection, for example, in Beijing, in a short period of time, a couple of weeks' time, actually, Beijing has a population of 20 million. Then, in a sense, isn't it inevitable, probably you will experience some degree of medicine shortage?
Yeah, absolutely, Chindu. I mean, it's very natural. People, when they hear about this, they were going to the stores and they're just literally just grabbing as many packets as they could carry. And that's not the right way. I mean, if it had been fairly distributed, the government stepped in and said, look, only 20 tabs per person. Remember, the medicines that they're trying to get are basically fever reducers. So these are, not complex medicines, but people were taking too many. So most people have between no symptoms up to 5-6 days of fever. So they don't need, 100 pills or anything like this. And unfortunately, that led to a shortage, and now that is being addressed both by the government in terms of restricting the number of tablets and also by the manufacturers who are really pumping it up. They're about 4 times the level that they were prior to the beginning of this new outbreak.
Mm-hmm. Well, Naijun, we know that China, as the world's factory, known as the factory of the world, has a strong capacity in terms of manufacturing, in particular medicines, and other drugs here. If you look at the latest number, the combined domestic daily production capacity and also production volume of 2 popular fever reducers now stand at 202 million tablets and 190 million tablets respectively. The daily production capacity and the production volume of the 2 drugs are now 4 times higher compared with early in December. So how confident are you that the supply will be largely adequate, for the needs of the public for the time to come?
Well, I think we do not have to worry about our production capacity or the production volume, as you have mentioned. I think the previous concerns and controversies about the medicine capacity is due to the change of our policy. As we know that during the dynamic zero policy, whenever people want to buy any medicine relating to COVID, relating to fever or cold, they have to register their name. They have to go through nucleic acid test, or their health kit will be labeled as yellow or other issues. So the pharmaceutical stores will not store so many medicines because people do not want to buy or can't buy more medicines they have needed. But right now we have lifted all these measures, and right now people, in my opinion, are free to buy any medicines if they want. So I think the transfer period during this period, the pharmaceutical stores I think are not fully prepared, or they do not want to be fully prepared because if they have more medicines, they can't sell it out. So I think we must give our pharmaceutical stores some time to make them ready for this change of policy and the transfer of time. So I don't think it's due to the production capacity. I think it's just a kind of adaptation to the new policy.
Yeah, adaptation to the new situation. As part of preparations, some makeshift hospitals previously used for quarantine purposes have been transformed into designated hospitals to treat COVID infections. Actually, at the State Council's press briefing, Jiao Yahui, director of the Medical Affairs Department at the Chinese National Health Commission, introduced the latest on how medical resources are being allocated and prepared in China. Let's take a listen.
In terms of total usage of intensive care beds now, there's still a certain amount of redundancy nationwide. Although the use of critical care resources is on a steady rise, it has not yet reached our critical threshold on a national average, which is 80% utilization. However, in some cities and regions such as Beijing, Sichuan, Zhejiang, and Hebei, the usage of intensive care beds in these areas comes close to or exceeds the critical line. Therefore, we have established mechanisms for regional coordination and support at the provincial and national levels. That is to say, when resources exceed the warning line, we will take advantage of the countrywide system and allocate resources from those areas where the infection has not yet peaked or has reached redundancy. We can also allocate human resources and equipment for support to these areas as needed. Actually, we've been doing that for the past 3 years already.
Okay, the government has been preparing over the past 3 years during this dynamic zero COVID policy implementation. Alice, in an ideal situation, you can always do better. I mean, with any government, any country. But then, if you open up the society, I also see in many countries, especially at the very beginning, you will experience a certain degree of, say, unforeseen pressures and challenges. I mean, is that the
Absolutely.
case with yeah, go ahead.
Right. So even in South Korea during our Omicron surge that started in the third week of January of this year, so almost a year ago, we saw a huge level of strain on our healthcare system. During February, March, and April, unfortunately, there were a large number of deaths. And so I think in China's case, because you have the advantage of being able to see what was done correctly, what could have been done better in other countries, you can adapt a lot of these lessons to your own situation. So having enough critical care beds, being able to be nimble in terms of if one healthcare system goes on overflow, what are you going to do in terms of backup? Having a plan B, a plan C. This is going to be very important. Being nimble and adaptable, and having every day an assessment of the situation, seeing if you need to divert resources to a system that is perhaps in danger. And so you have to keep a very close eye on hospital capacity, ICU occupancy rates. And I would raise the point about treatment and production of medications. I think the focus needs to be on antiviral medication production. And people need to realize that if you are low risk for severe disease, for COVID, in most cases, you're not going to need antiviral treatment. And the fever medications, the cough and cold medications, these are symptomatic medications. In other words, they help relieve symptoms. They're not really curing COVID. COVID, your own body will cure if you are healthy and low risk. We need to focus on having enough treatments, antiviral treatments such as Paxlovid, Remdesivir, Molnupiravir, medical oxygen, dexamethasone, which is a steroid. Enough of these treatments for people who are at high risk for severe disease for COVID. So that needs to be the focus, and making sure that there are enough supplies of these medications for your population, which unfortunately, you have 250 million people who are over the age of 60 living in China. They are all considered high risk. So you need to have enough medications because potentially 80% of these people may get COVID.
Mm-hmm. Well, Anna, that's a good point, given this large population, in particular this elderly population in China. And you do see the government is changing its focus from prevention to treating of the symptoms, in particular with this vulnerable group, those at a senior age or with existing conditions. You see the rapid approval and also introduction of the antiviral medicines, for example, Paxlovid in China. So, I mean, hopefully the situation will get better and better.
Yeah, it will. Unfortunately, there are people at risk. I mean, people over 80, only 65% have been vaccinated, although there was a 90% number for the general population. But, you know, while we're discussing a lot of the technical issues, very important, you know, you have to have this kind of response available. But let's talk about the elephant in the room, which is the fact that China was able to delay its opening up for 3 years. With very, very little damage, less than 6,000 deaths. Just to keep in mind and perspective, in the United States, every 2 weeks, there's 8,000 people who die from COVID. And that has been the trend since last January. So we're coming up to a year on that. So this idea that somehow China has failed its people, which is the popular narrative, is just plain wrong. China is opening up. They're doing what is necessary. They knew long term that you could not just walk away from this thing or you know, basically say we'll put up walls and that will prevent anything from happening. They made a conscious decision to go forward, and you know, history is going to be the judge of this. We're going to start, you know, 2 years from now. We're going to be looking at the statistics, and my guess is that China is going to be well heads and shoulders above those nations which took no actions or, you know, completely messed up their response early on by allowing their countries to be infected too early.
Mm-hmm. Well, Naijun, let's take a closer look at some of the changes of the policy. We know that in terms of classification, the COVID infection or infectious disease has been downgraded from Class A to Class B infectious disease. And also the government will change the name, official name, to novel coronavirus infection. Tell us, what does that mean, you know, the downgrading of this classification?
Well, in my opinion, I think the policy is very clear that in the past, the COVID has been classified as degree B from the beginning. Although our measure and the policy are classified as A. So I don't think we have tremendous change. What we have changed is just some details of our prevention and control policy. Mm-hmm. For example, the infected people will not go through a specified quarantine. They can stay at home. And secondly, we will never describe people as contact people with infections, and we will not have the high-risk regions anymore, etc., etc. So from my point of view, I think the policy only changed some details of our prevention and control measure. And right now, I think all the people themselves will have more responsibilities in treating their own health behaviors and actions. That is to say, whenever they are infected, in the past, I think they will go through some strict specified quarantine, but right now they are allowed to stay at home, and whether they are allowed to go out of their house is depend on their own decisions. So I think more and more responsibilities and decisions will be given to the people themselves. So I don't think this is easier. I think it is more comprehensive, and it is more, in my opinion, more publicly beneficiary for our people to think their behavior and responsibilities.
Mm-hmm. So Alice, this is, as Naijun pointed out, this is not a big change, but still very decisive change in the sense of, the government will treat the disease as one of the category B diseases. There are some of them, but it's becoming like more common, more acceptable. Probably we will live along with the virus for the time to come. And so that's the beginning of the new reality.
Right. So I think two things. First of all, even though it's category B, there's still a responsibility to diagnose and to report cases. And of course, people will be getting treated. But basically, it's an acknowledgement of two things. First of all, it's not just COVID pneumonia, it's COVID illness. So it's a recognition of the spectrum, I think, of COVID-19, that is not just pneumonia. There are many different manifestations of COVID-19, and so people need to be aware of that. You have everyone from asymptomatic cases to pneumonia and sepsis, very severe cases as well. And then the other thing that's being acknowledged is that the impact of COVID-19 has changed, right? Because of vaccination and a higher level of immunity in the community. It's not as deadly as a disease, of course, as it was in the beginning. And so because the impact has changed and there's an acknowledgement of the wider spectrum of this disease, I think it makes sense to have a different name for it and also just to approach it differently. In terms of isolation requirements, every country has different mandates, I think, in place. It does depend on how willing you are as a community to risk amplified spread, I think, of the disease. Here in Korea, we do still have a mandated isolation period if you do test positive. And that's, I think, has to do with, first of all, just the high population density in our country, but also there's a certain work ethic or work culture where unless you're absolutely very, very sick, a person is really not going to stay at home from work. But because we have this mandate, people can call in sick, they're guaranteed sick leave, and it's recognized by the employer and also the government that you are allowed to take time off and stay at home if you do have COVID, even if you don't have severe symptoms. So every country has a different policy, and it really just depends on how willing people are to accept it.
Well, probably still in the face of changing the practice. But also related to the question here, Alice, in China, some people are concerned with what they call a white lung symptom, which refers to the white spots shown on the lungs in X-rays or CT of some COVID patients suffering from acute respiratory distress. So what does that mean, the symptom? What's the message, if you read all their white lungs, white spots on the organ?
Right, so on an X-ray or a CT scan, air shows up as black, and anything that is water-based or tissue or solid is white. So it's not unique to COVID that when you get pneumonia, you will see on an X-ray what appears as white where you would see black. Your lungs are normally just full of air, and so that's why they appear black. As you have an increase in cases in the community, there will naturally be more cases of COVID pneumonia, and so that's when you take an X-ray, you would expect to see white on the lung fields on an X-ray or a CT scan. So this is not a new phenomenon whatsoever. I think this just has to do with epidemiologically what's going on in terms of an increased number of cases with pneumonia due to COVID in the community.
Well, Anna, with this lifting of a lot of let's say restrictions in terms of inbound and outbound travelers, tourists, but at the same time we are seeing several countries are imposing, I would say, requirements probably for the Chinese travelers. 48 hours before the boarding, you needed to have a negative test before you board the plane. What do you make of that? Is that becoming a standard practice? As we are ending this outbreak, because China also does that too.
Yeah, and this is the part I don't understand. It's become a big controversy, but it's really semantics. It's the same thing. China requires a 48-hour test. The U.S. is doing the same. As my colleague pointed out, if you go to Korea and you test positive, they ask you to isolate. Now, the big issue here is where you isolate. If you're allowed to isolate in your hotel room, that's completely different from being taken to an anonymous center or sent to somewhere where you really didn't know. So I think once that's standardized, people get used to it. It is not a big deal to take a test prior to getting on a crowded airplane. Right. That's not only for your own protection, but that's really responsibility. And then sometimes I don't hear enough about that.
That's a new reality. Well, with that, we come to the end of today's discussion. Many thanks to our guests. You can also find us on the CGTN app on YouTube. I'm Hu Naijun. Thank you for being with us. See you next time.